This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Hey everyone, my name is Anish Parkash. I'm a PGY3 at Tower Health. I want to thank PM&R Scholars for having us and everyone else for attending, taking their time. I know everyone's busy. While I also will try to share my screen, I got two other residents on here with me who are going to introduce themselves.
How you doing, guys? I'm John. I'm also a PGY3, Tower Health. Super excited to present to you guys tonight. I hope you learned something from us. Thank you for taking the time to come out and listen.
Hey everybody, sorry, Anish.
Go ahead.
I'm Joe. I'm one of the PGY1s this year. If you all have any questions about intern year, let me know.
Thumbs up if you can see my screen. Okay, good. All right. I'm going to blow through this as well so we can get to questions. So we are Tower Health PM&R. We are 111 standalone rehab that we're connected to Reading Hospital. We have 61 acute rehab beds, 11 secured TBI beds, and TSU or a SNF, like they call it, 50 beds. On site, we have pharmacy, aquatic therapy pool, labs, radiological services. We have 11 physiatrists attendings on staff in the building most of the time, except for the consulting physician who's at the main hospital. We have over 950, I would say over 1,000 consults at Reading Hospital. We have a really nice healing garden. We have a putting green and a dedicated interdisciplinary team. Our main campus is Reading Hospital. It's the busiest ED in Pennsylvania, 10th busiest in the country. Level 1 trauma center, 700 plus beds, 70 ICU beds. Numerous residency programs and fellowships for those who are interested in couples matching. We have, the state-of-the-art technology with operating suites, procedure rooms, et cetera, et cetera. So training at Tower Health, one thing I'll talk about is our program was designed to run without residents. So that means, you're not forced or, dedicated to work if you want to attend a conference. I'm applying for a pain fellowship. I've never been denied to attend any conference. We have no night call throughout your whole residency. You do have night float as an intern, but as a PM&R categorical resident, you work 1 weekend a month as a PGY2. As a PGY3, you work maybe 4 to 5 weekends a year. And as a 4, you will not work any weekend. And you'll work 1 holiday or 2 holidays as a PM&R categorical resident. If you work 2 holidays in a year, you're done for the rest of your residency. So our schedule is very conducive to wellness and to other, things outside of work and fellowship aspirations. So this is a quick overview of our schedule. PGY2 is mainly inpatient, 8 months. 4 months you do get outpatient, which is great. I already have 35 EMGs under my belt. John probably has a little more, depending on who you rotate with as a 2. So you're going to blow through your procedure numbers with EMGs, injections. I've done Botox injections, outpatient and even inpatient. We're able to do some. So we're pretty procedure heavy. PGY3 is mainly outpatient, except for TBI. TBI is 3 months. They're very conducive to putting your elective months very early if you're applying for fellowship, so you can get your letters and so on and so forth. we're allowed to do away rotations and observerships if you can make time. So again, very conducive to applying for fellowship. As a 4, again, it's mainly outpatient. You do inpatient senior. Some of the electives that are available are pain management, sports, neurology, movement disorders. I did the pain elective, very procedural heavy. I was doing epidurals and everything on my first day with them. Something a little bit about our ARU, East Wing, 25 beds. We have a section for each discipline. So we have a Parkinson's section, amputee. The Parkinson's, trauma, and complex medical are one section, amputee, stroke, SCI is another section, and TBI is its own secured unit. We have easily 56 to 60 patients. We have multiple gyms in the hospital. We have an exoskeleton, a lot of cool technology. TSU, we're the consulting service. We do have hospitalists on staff, so they manage most of the patients' medical issues. We do part of that, but if it's above our, above our head, they definitely take over. Outpatient clinic, like I talked about, we do, over 2,500 EMGs, a bunch of toxin injections, MSK, ultrasound guided injections. We do ultrasound basically day one as a PM&R resident, even as an intern. When you spend time with us, you're learning ultrasound. We have an amputee clinic, Parkinson's clinic, wheelchair, orthotics, and we refill and manage baclofen pumps. Our only offsite rotation besides Reading Hospital is Good Shepherd. That's our peds hospital. That's 2 months as a 4. I haven't done it yet, obviously, but it's a varying pathology. You're going to see a lot of cerebral palsy. You'll be able to do toxin injections there. We do peds toxin injections in our outpatient, and we get involved early with that too at a surgery center as well. We are Drexel's home site. Drexel's new campus is called Drexel University College of Medicine at Tower Health. Brand new, beautiful building. We do have badge access. We do anatomy lab there. And we do have a mentorship program going on with the Drexel med students. So as you're a PGY2, you'll be matched with a med student, MS2. And as you go on, you both will, present case reports at national conferences and help them apply for their PM&R residency eventually. I'm going to throw this over to my co-resident Joe Kenny, because our program just became categorical, so now there's 12 of us, and he's part of the inaugural intern class.
Hey guys, yeah, so a little bit about the first year. It's set up kind of like a transitional year, so we get just 3 months of general medicine floors. We also do get some exposure to PM&R in our first month, which is really nice. And then if your schedule works out like mine did, I just finished my week of night float for the year, and that's the only nights that we do throughout our residency, so that's really nice. And then we also have like an inpatient neurology block, trauma surgery, orthopedic surgery, so we get a lot of exposure to different areas, which is really nice, and prepares us for our next 3 years over at the rehab hospital.
Thanks, Joe. Salary, you guys can look this up. It's nice. We have 4 weeks of vacation and we have 5 separate sick days. So that's really unique and nice. Education funds, $2,000 per year once you become a PM&R resident. And then you can apply for special scholarships if you're presenting at conferences. We do a lot of unique stuff. We do work with a street medicine clinic with internal medicine. We work with I Am Able. It's a specialty gym working with veterans and disabled people. I'm going to volunteer with them and just help them work out, help veterans work out. We do sports coverage with Drexel. I think once I'm finished, John can speak to that. He's done some coverage with their basketball team, and they have a wrestling team, and there's some other smaller schools we work with as well. We work with marathons. We have a bunch of wellness initiatives. We're always hanging out, going out in the Penn Avenue, which is the main street over here. We're having end of each block as a PGY2, they have 2-month blocks. When they end it, we have a wellness initiative. We have a happy hour. We get drinks at attending's house, go to a restaurant or a bar. That's me. I presented at 3 pain conferences last year. So like I said, they're very supportive. Even my first month as a PGY2, a brand new resident, they said, go, go, go. So this year I'll be attending multiple as well, and they're very supportive. They want me to succeed. They've never told me not to look at all, learn general rehab. They knew what I was interested in. They supported me from day one. We have a big medical library, 24-hour access at the main hospital, bunch of librarians and statisticians to work with you on any research project you could imagine. And one of the IM associate program directors is research heavy, and the hospitalist at our rehab hospital is the chair of the IRB. So a lot of resources for research. Social stuff, downtown Philly is about an hour away. You could commute as a PGY2 because we don't take any night call if you wanted to live in downtown Philly. West Riding is not cheap, but it's not expensive. One bedrooms can run anywhere from $900 to $1,500, depending on what kind of place you want to live in. We have a bunch of food, bunch of breweries, bunch of different pockets outside of Philly, all the way to Reading. So a lot to do. Entertainment, again, minor league team, about Philly sports. I'm not going to go into that. Bunch of trails, bunch of outdoor things to do. We're very centrally located. I just went to DC over the weekend. It was a quick 2.5 hour drive, less than 3 hours. New York's, again, 2.5 hours unless you hit traffic. Philly, I would say, depending if you hit traffic, it'd be an hour plus. And so that's all that. This is just a bunch of our outings. We hang out a lot together. Like I said, we celebrate a lot of different things. We celebrate birthdays. We're very camaraderie and collegiate. So I'm going to leave it up to questions.
Be happy to answer any questions you guys have. Thanks, Anish, for going through all that. If you guys want to throw them in the chat or just talk here, I'd be happy to answer anything for you. Again, thanks for coming out. Hope you learned something.
Something new at our program that we're excited about. I think getting the interns in, because we automatically went from a class of 4 as PGY2s to a class of 12, getting 4 more new 2s and 4 more new interns. So our class, tripled. So that's been really enjoyable. Getting to new personalities, a lot more, social activities. So that's something that's really, and our program is just very adaptable. So it's been exciting getting to know one another.
Yeah, I think getting into the PGY3 year now and doing this, like pain, I'm on my pain month now, getting in the procedure lab, doing tons of injections and seeing those pain patients and kind of getting into the outpatient aspect away from the inpatient stuff. Super exciting to get that going and build things up. I know Anish mentioned the sports coverage. We do have connection with Drexel University Sports. I've done some sideline coverage with them for their basketball team. It's really cool. We also have we're trying to set up affiliation via the trauma service with the Reading Royals, which is a minor league hockey team. But we definitely have access to do sideline coverage with all of Drexel fall, winter, and spring sports, if that's something you're interested in doing.
What do I think is best? Again, our schedule is phenomenal. Working one weekend as a 2, 4 or 5 weekends. I'll work maybe 3 weekends till December. So that's amazing. Our attendings are as nice as can be. They teach a lot. Your attending ratio is very small. You're one-on-one with the attending for now, and then you'll be 2-to-1. And they're very adaptable. Like I said, they adjusted our schedules to put our electives if we're pursuing fellowship. If they're not, so be it. So our coordinator really works hard with us to, push whatever our career aspirations are. And, any opportunities they see, they email us, they tell us, so on and so forth.
All right, so I'm just going to go down the chat here. Where do graduates of your program tend to go after residency? No one has graduated yet, so to be determined. I know a couple of us are interested in pain. One of us is interested in sports. So I think some of us are going to be applying. Well, I know that 3 of the 4 of us will be applying fellowship soon. And then we'll see. To be determined on that one.
DO students, Comlex 1 and 2 are enough, definitely. Yeah, we're not DO biased. We're not IMG biased. Our inaugural class was all IMGs. Now it seems like we're going to take at least 1 per year. And we've taken multiple DOs, multiple American MDs. So
during inpatient rotations, are the hospitalist consultants to manage medical issues, or the residents manage those? So they are there to guide us. Your patients as PM&R residents are your patients, but the hospitalists are there to help co-manage. But they're more of just like a guiding. They guide you for issues that, oh, maybe I'm not so sure on this, so let me ask the hospitalist. They're there to help. But you take control of your patients. You handle the medical issues as you see fit. And if you need the help, they're there to guide you and give suggestions as like a co-management / consultant.
Tower Health, you have about 5 minutes left.
Okay, great.
I'll ask the same question. Is there any particular patient population that you feel like you get a unique exposure to?
So
Yeah.
our inpatient units, as Anish was talking about, we have a brain injury unit, stroke, spinal cord, amputee, complex med, Parkinson's, like neuromuscular medicine. I would say the stroke service, TBI service are probably the 2 busiest, just based on our patient population. The stroke service is always constantly full, having tons of patients, a lot of turnover. Our complex medicine, orthopedics, trauma unit is 13 beds, and that's always full, constant turnover.
Amputee, I feel like we have one attending who's an amputee expert. He works with Hanger, prosthetic company. So you'll have multiple amps throughout that service. You'll get familiar with prosthetic trainers who come back for training, especially. And then we get spinal cord, it's ebbs and flows. We do get a lot of spinal cord, at times, sometimes they're lulls, but when they come in waves, and they come seriously, significant, serious injuries. So you get to learn about trachs, you'll get to learn about proper bowel program, bladder program, that type of stuff. Yeah, there's nothing and we get to see very unique pathology. I've seen Creutzfeldt-Jakob disease twice now, which is, I thought was rare. We had hemibolismus in a newly diagnosed diabetic. So a lot of rare stuff you'll see, just because we're such a big center we're getting fed from, and we're like in between Philly and Pittsburgh.
Tower Health, 2 minutes.
All right, I think that should wrap it up. Again, I want to thank PM&R Scholars. I hope everybody checks us out. Obviously we're a new program, but we're growing. And again, we have a collegiate environment, and probably, one of the better schedules, without compromising your learning, without compromising your career aspirations. Thank you very much.
I left my email in the chat. If anybody has questions or wants to reach out, feel free to do it at any time.
Yeah, mine is
Thanks,
in there
guys.
as well, if anybody has any questions about first year.
Thanks, guys.